Hello everybody, we're back! And our crash course for today is all about mandibular advancement devices.
We will explain it to you briefly so all of you can have an idea.
That's right! But first,
Let's define mandibular advancement device. So generally, it is a dental appliance similar to a gum shield which is worn in your mouth while you sleep. These can also be called as mandibular advancement splint, mandibular repositioning appliance, oral appliance, or dental device.
And the purpose of these devices is to serve as a treatment to control sleep apnea.
sleep apnea is a condition, I repeat, a condition in which the airway in your throat collapses when you sleep, so the muscles relax. If this collapse is constant, it causes apnea, or simply said, absence of breath. If the collapse is not constant, usually it causes snoring.
Maybe you're curious how these devices help during sleep apnea. Well, it holds the airway open by bringing the mandible slightly forward while you're sleeping, and it keeps the tongue in such a manner that it is prevented from falling backwards during sleep that can cause airway obstruction.
There's actually a thing called CPAP, or the continuous positive airway pressure, which is a machine that sends a constant flow of airway pressure to your throat to ensure that your airway stays open during sleep. Unfortunately, there are lots of people who cannot tolerate CPAP therapy and decide to use other treatments like surgery to the airway or the use of an oral appliance.
Now that you have an idea why these devices are important, there's also indications on when to use such devices. First, if you have mild or moderate sleep apnea with 20 to 30 events per hour, mandibular advancement splint is a good substitute for CPAP. Second, if your bottom jaw that recedes a little causes sleep apnea, the use of mandibular advancement splint is ideal. Third, if your sleep apnea is better when you lie on your side than you're on your back, it is advisable to use a mandibular advancement device.
These devices are contraindicated when there's insufficient teeth to support the oral appliance, periodontal problems, active temporomandibular joint disorder, maximum mandibular protrusion distance of less than 6 millimeters, and multiple comorbid conditions such as heart failure and respiratory failure, and even those with severe gag reflex.
So here are the list of the advantages of the mandibular advancement device. First, it is quick and easy to adapt by the patient. Second, the fabrication and the procedure is not difficult for the patient. And third, it is comfortable and easy to wear. Fourth, it is not expensive compared to the CPAP machine. And fifth, it is small and easy to travel with.
I'm sorry, but no one's perfect. There is also disadvantages of the mandibular advancement device. First, it can lead to an increased salivation, or the reverse, a dry mouth. Second, it can cause discomfort to the tooth from the appliance. Third, irritated gum tissues from mouth breathing. And oh no, the patient's bite may be affected, and they can also experience temporary disharmonies of the temporomandibular joint. In terms of taking care of the appliance, we all know that the device is worn while we sleep, so it makes it even more important to maintain a good oral hygiene to prevent oral diseases. Of course, the device should be cleaned before inserted into the mouth, and you should also brush your teeth before wearing the device. And when you wake up in the morning, the device should be removed and cleaned with a toothbrush and a soap or a toothpaste. It should also be
soak in an appliance cleanser and rinse with clean water. And after cleaning the device, you should store it in a provided container so it will be ready when you want to use it again.
So now, let me show you how dentists and dental technicians work together to form an MAD. An MAD could either be a non-adjustable one-piece or an adjustable two-piece MAD. The non-adjustable one-piece could either be also prefabricated or custom-made. The custom-made one-piece is constructed from a thermoplastic material that becomes moldable when warmed in immersion in hot water. The user then takes a mold of their teeth by biting into the softened material, then sends it to cooling. Then, tada! Now you have a custom-made one-piece MAD.
The custom-made adjustable two-piece. These MADs are constructed in a lab using dental impressions from dentists. These impressions are then made into casts. But before putting it on the vacuum former, the undercuts of the cast are first blocked off by wax and should carve out any distortions that may disrupt the shape of the MAD. Mark the template on the model cast between the upper canine and premolar, then between the lower last molars. Place the model on the vacuum former, ready the vacuum forming disc in the foil holder, and heat the disc until it is ready to be pressed down into the cast. Then let it cool down. Cut the excess foil around the device and remove it from the cast. Smoothen out the edges of the device and follow the shape of the teeth. Use the same procedure with the other cast. Then put back the made device on the cast, then roughen out the device at the place where we marked on the cast and on its occlusal surfaces. This is where we will put the acrylic for adhesion. The bite pads are then placed on the occlusal areas, while the strap hooks are placed on the buccal areas, both on the upper and the lower devices. Cure the acrylic with a pressure pot, then place the rubber straps over the hooks on the upper and lower trays.
So, if you're looking for a prefabricated MAD, this would cost you at the amount of 2,450 pesos.
And for the doctor's fee, it will cost around 15,000 pesos to 25,000 pesos.
So here's a case where this device is used. A 38-year-old female was diagnosed with mild obstructive sleep apnea. In her history, the patient reported gagging and interrupted breathing during sleep. Her main complaint was loud snoring. During the oral examination, it showed a complete upper denture and a partial lower prosthesis, constructed 8 months before. The 7 remaining teeth were a good periodontal condition and did not have caries. The alveolar ridge was good bone support and had a healthy aspect. Figure 1 shows the intraoral condition with and without the prosthesis. Figure 2 shows patient with dentures and MAD is installed.
Treatment with mandibular advancement device over prosthesis may be possible. However, it is necessary broad oral assessment including mucosa, teeth, and stability of prosthesis. Monitoring of possible side effects is necessary to treatment at long time.
That's it, guys. I hope you learned a thing or two.
And make sure to know it by heart, so you can provide this treatment in case you encounter patients with sleep apnea in the future. That's right! Thanks for watching and see you next time. Bye! All about mandibular devisement. Oh, that's it!
All of you can
May pahabol pa siya, te. Te, di talaga siya natigil.
Lagay mo nga sa bloopers yun, Mikey.
That's it, guys. I hope you learn and think out. Okay.
Tawa pa siya.